Welcome, Facebook family. Thank you so much for joining us again as we continue to embark on this wonderful series in fatherhood entitled Hope, Health, and Fatherhood, and what we fathers can do to promote healthy habits that will transcend generations. My name is Anthony Mingo. I've got the privilege to serve here at the Health Department as the unit manager for the community outreach and engagement unit here within Fairfax County Health Department. Welcome and thank you so much for joining us. We've got um, a, um, a wonderful, esteemed guest today, a colleague of mine that works here at the health department. As you know, we've been centering in these series, specifically looking at fatherhood from a cultural lens, understanding that fatherhood transcends countries, cities, villages. It is just so we wanted to bring from a public health perspective a cultural view to fatherhood. So we understand that fatherhood transcends, as I mentioned, countries, but also individual fathering styles from person to culture to culture. So we want to dig deep and peel back and look at that as well today. As we move through today's conversation, today we're just going to have, and as we will every week, a really transparent conversation centered on fatherhood and the benefits of fatherhood, engaged fathering to healthy and improved health outcomes generationally. Today, so let's get started. Today, I've got an awesome gentleman here, Frank Owusu. Um, who works alongside me here at the Fairfax County Health Department. He's a community health specialist. He's doing wonderful work um, in the African community here in Fairfax County. As you know, we're a melting pot and we've got many different communities, and you'll be hearing more from our communities as we go forward with this series. But again, the importance of fatherhood and our roles in fatherhood. So today, a couple of things we want to discuss is the four pillars of health from a cultural lens, and those pillars being our physical, our emotional, our mental health, and our spiritual health, and the importance of our fathers having um, an understanding of these four pillars and how in the role that it plays in the health of our families, and then how again it moves transcends generations. So today again, Frank, welcome. I'm excited to have you here. Thank you for being such a valuable contributing and committed employee here at the Fairfax County Health Department, and also to the African community and the other communities that you serve, because I know that you serve primarily the African community, but as we all do here at the Health Department, we all serve all of our communities. So thank you and welcome. Why don't you tell us a little bit about yourself?
All right, sir. Thank you very much for having me. So my name is Frank Owusu. I was born and raised in Ghana. Um, I moved to the States in 2012 to be with my wife. I was telling you the story of how I met my wife. We used to be in the same school back in Ghana and in the same church as well. So she left around late 2000 to be with her parents here in the US. And then through some divine intervention, God sorted, found it expedient to bring us together. And so in February 2012, I moved from Ghana to be with her. So in the last 10 years, I've worked in different capacities within the healthcare sector. But my work here at the health department as a community health specialist uh, dedicated to the African community entails just leveraging the help and expertise of my community partners to develop health programs, messaging that are culturally germane to the health needs and health outcomes of the African community. And I'm extremely lucky to serve with the folks that I work alongside in this department. Like I said, I'm happily married. We're going on 10 years. Our anniversary is in 3 weeks' time. We are blessed with two wonderful kids. My first is a boy, Preston. He just turned 9. And then our second child is Milani. She's a girl, and then she will be 5. She will be 6 years in a couple of months. My wife has been a pillar behind me, and she's been amazing. She keeps me on the straight and narrow, and I couldn't have asked for a better partner in this life journey. And I am a Christian, a proud Christian, and this might not be popular, but I always tell people that I come across that my faith is my lodestar. It has held my hand through very sticky situations, and I'm happy to profess my faith everywhere I go. So just a bit about me.
Well, Frank, and thank you. Beautiful family, by the way, and
Thank you.
just such a wonderful sight to see that picture. Can I ask, just start with, because I know that you have come here
Mhm.
as a public health professional. Could you tell us a little bit about your background in your country of Ghana
Yeah.
and how that brought you here, and then maybe land at your commitment to health?
Okay. I was trained as a doctor in Ghana. I only practiced for about 2 years as a general practitioner before I moved over to the States. So my commitment to health has it comes from let's see. I mean, it's ingrained in my background. So during my school days, I used to volunteer in the villages around the country, just immunizing kids underserved kids from underserved communities. So that is the kind of pull that drew me to public health. And then since I got into this field, I haven't looked in any other ways. I am fully invested in the work of public health, especially making sure that people from underserved communities and underserved backgrounds, like the one I come from, have an equitable access to the kind of healthcare that we all desire for ourselves. So that has been my professional goal, just to spread the word about public health and ensure that everyone has equitable access to health resources.
Thank you, Frank. We talked earlier in the intro that a lot of our conversation is going to center around the four pillars of health that we talked about: our emotional health, our mental health, our physical health, and our spiritual health.
Yeah.
Can we take a moment just to kind of unpack some of these? I think from your perspective, and
Hmm.
maybe even from the perspective of your culture, maybe even the perspective of your faith, whatever you're comfortable with.
Yeah.
But if we can we start with um, what does the phrase spiritual health mean to you, and how do you see that in your fatherhood role, and how it contributes to your fatherhood role?
Okay. So the way I see spiritual health is the kind of wholesomeness that flows from having a meaningful relationship with the divine, the source of life. So I know you are a minister of the word, so you know what the Bible says about a good shepherd in the book of Psalms. So the shepherd is the one that restores our souls and lead us beside the still waters. So no matter how turbulent life gets, we have a source of hope that we can always draw from, and a source of inspiration that we can always draw from. And drawing from that source always brings some form of wholesomeness and meaning to life in general. So my wife and I, we are very intentional about the way that we live out our faith in the home. We want it to be an example to the kids. Um, just to know that there's something beyond, something greater beyond the physical. That's the things that we're able to see, and that thing is a source of our inspiration and wellness. So we make sure that we pray together as a family. Everyone takes a turn to pray, and then we teach the Bible to our kids. It is something that I that was imbued in me by my parents. They make sure that we went to church every weekend. We learned the Bible in addition to whatever we were learning at school. As my father explained to me, it is what makes a man whole. Yeah, so we make sure that we are imparting that onto our kids, so they can watch all the shows that they want to watch. They can watch all the Barbie, the Elsa, the Sonic Dash. But in addition, we also require that they do at least an episode of Superbook and summarize one Bible character to us every evening. So if there's anything that I desire the most to bequeath to my kids, it is this experience of a deeper connection with God.
Wonderful, and I love the intentionality that
Yeah.
you just laid out, and I think that that word being intentional
Mm.
is in fatherhood and all these aspects is really really important. So, thank you for that. As we move to the next pillar, CDC in a recent study mentions that 12% of our adult population in this country have regular feelings of anxiety and worry. And I was wondering, from a mental health perspective and how that relates to how we are as fathers in our homes with our families. Do you have could you kind of give me some positive habits that you practice inside your home
Yeah.
around that?
Yeah. So as you just laid out, life can be very stressful,
Mm,
and parenting in general can be an stressful experience as well. So what I do is just to keep a positive outlook on life. So I do not harbor any negative feelings. I do not bring carry over the stress or work back into the house. Um, and there's so much negativity going on in the news media these days. So I make sure not to get hung up on all the negativity that is very evident in the news media these days. So instead, I make sure I spend more quality time with my family. So that will include activities like helping with prepping dinner, helping them with their homework, reading stories together, doing family activities that ensures bonding and brings a sense of well-being and wholesomeness to me and to my family. And then sound mental health could also involve a knowledge of your self-worth, being able
mm,
to figure out who you are and your worth as a human being. So
yes.
it is some of these little habits that I try to portray to my kids and ingraining them at this early age so that they become well-rounded as they grow up and interact with society.
Thank you, Frank. You're modeling positive mental health,
Yeah.
and that's wonderful. So let's park on or our next stop on this journey is kind of the cousin, right?
Mm,
Is emotional health
yeah.
and expression of such or men. We tend to either hold it in or it's all the way to the other spectrum.
Yeah.
So how do you find balance in healthy way within the home in terms of your emotional health?
Okay. Yeah. Thank you very much for this question. So growing up in Ghana, we grew up in a culture where parents were not allowed to be vulnerable around their kids. So, for instance, the only emotion that I experienced from my dad especially was anger. So, you were told to bottle up all your emotions as a man, to keep it all together, all under wraps, and deal with it as a man. But I've growing up, I found out that wasn't very helpful. It kind of made some of us very timid and shy when we go into public settings. So what I do I encourage my kids to be in touch with their feelings, with their emotions, and to be able to be expressive of those feelings or emotions in a very supportive environment. So we put a human face to the emotions that we go through in our daily lives. So we are raising two kids who are on the opposite sides of the emotional spectrum, if there's anything like that. So my son is extremely moody, and he can be, yeah, he's more like me. He gets moody very easily. My daughter, on the other hand, is very buoyant, very gregarious, and she's easygoing. So we make it a point to create a right balance in the home, to create a right environment where everyone's emotional range, a range of emotions, is supported at each time. And of course, we set healthy boundaries as well. So you could be angry, but you're not allowed to punch holes in the walls or
Yeah.
to take out your anger on on someone else. So we kind of set those boundaries for them, let them know that it's okay to be angry, but the actions that follow from that anger could have dire consequences for you.
Yeah. Thank you for that.
Yeah,
Quickly moving to our next pillar, physical health.
yeah.
Clearly that's vitally important as well.
Mm,
Could you share your experiences again with you and your children, your family around physical health?
yeah. So, to be completely honest, this is an area that I struggle um, myself, and this is one area I have my wife to be extremely thankful for. She is the one that keeps the whole family going. I live close to Winchester, so I drive to and from work about 140 miles a day. So all I want to do after work is just to have a good meal, just lay down watching TV or reading a good book. But she's the one that ensures that we are not only eating healthy, but also drinking healthy, drink water instead of sugary drinks and stuff like that that are not good for our bodies. And then she also ensure that we are moving a lot. So we are taking walks in the neighborhood after dinner, just to help with digestion and also our overall health. And whenever the weather is nice, we take the kids out to Sharando Park, where they can ride their bikes or their scooters. And then we also just adore nature, just being in tune with nature. And we also prioritize healthy sleep in the house. So everybody has a bedtime, whether it's a weekend or a school day or working day, and then we try to model this behavior to the kids, so they know the importance of a healthy sleep, and how it is needed to revitalize our bodies and replenish our energies. Right.
Thank you. Thank you.
Mm,
Um, as we're winding down, just a couple more questions.
yeah.
One, you, as mentioned earlier, you're from Ghana,
Yeah.
in Africa, and although fatherhood is around the world, but
Hmm.
culture's impact on parenting styles. And I was just curious, you've been here now for over 10 years.
Yes.
Your experiences in Ghana versus experiences here. Is there anything that you could, those of us that are curious like me that love different cultures,
Hmm.
could you share some more of that for us?
Yes. Thank you very much for that. So the biggest difference I see between fatherhood in Ghana, in Africa at large, and the culture here in the US is, kids here have more autonomy, more self agency.
Hmm.
We encourage our kids to speak up for themselves more, and that is not the situation in Ghana. So over here, my 5-year-old daughter has a say in what she wears, what she eats, and I could I don't remember how old I was before I could make some of these decisions in Ghana. As long
Mm,
as you under your parents' roof, they make all of those decisions for you.
mm,
Um, it could be from something as minute as the kind of food to eat, to some life changing decisions like what course you take at college, for instance. So I went into medical school because my father had laid that path for me since I was a child. So he told me specifically, I remember I was like 8 or 7. that you're going to be a doctor. So you do not have any regular room to make your
Mm,
own decisions in some of these circumstances. The other difference that I see here in the US is fatherhood here is more hands-on. Fathers are more involved in their kids' life and their activities. I don't recall my father ever coming to any school activity that I was involved in, but that is not the case over here in the US. So fatherhood is more hands-on. There's a stronger bond between fathers and kids here in the US. Fathers in Ghana have an unusual way of expressing their love to you. They could buy you all the gifts that you desire, but that kind of personal bond is a bit lacking. And I think lastly, I would say that parents in Africa do not spare the rod.
mm,
So yeah, they do not spare the rod.
mm.
They they take correction and discipline a little too extreme. Um, we've come to know that there are several ways of disciplining kids and making them see eye to eye with your viewpoint, other than this um, hitting them with a rod or spanking them. So these are some of the differences that I see between fatherhood in Africa and over here in the US.
Wow, that's good.
Yeah,
Thank you, Frank. Very insightful.
yeah,
Um, Next, as we're winding down here, you know, um, what are some of the things like tools that you could share with fathers
mhm.
that are listening in to put in their fatherhood, healthy fatherhood toolbox? Is there anything that you could share with our fathers that may be looking in today?
Yes. So the first thing I would say is be intentional about the kind of habits that you model for your kids. We in public health know that most of the health struggles that we face later on in life are born out of the behaviors that we cultivated as kids.
Hmm.
So if we desire for our kids be to do well as they grow up to be healthy, we should begin teaching them right from infancy, so they it becomes a part of them. And the other thing I would also see is say is that parenthood is a teamwork. It's a teamwork. Women are very instrumental in that process. They serve as a big pillar behind the men. So we should always leverage their help. We shouldn't do it on our own, and then we should also leave it also on to the women to do all the heavy lifting. We should form a partnership that works in the home, and that will be beneficial to us as fathers and also to the kids that we are raising. And perhaps the last thing that I will share is we should make the most of the time, whatever little time we have with our kids. If there's anything that COVID has taught us in the last 2 3 years, is that tomorrow is never promised. So we should make the most of every little opportunity that we get to spend with our kids, and then we'll be all the more better for it. Thank you very much.
Frank, that's wonderful, and it just the takeaways I want to just state again because just a wonderful impact here is that make the most of every single moment that you have an opportunity to be with your children and your families. I heard you talk about the importance of partnership. That
Yeah.
fatherhood is a partnership journey with the mother of your child,
Hmm.
and then I heard you say earlier, in being intentional
Yeah.
around the engagement with your children, understanding that your fatherhood journey, you're modeling fatherhood to the next generation. And, as I often say, is that your son is going to look to be like his father,
Yes.
and your daughter is going to look to her father as a model for the man that she one day will choose to be engaged with. So
Yes.
thank you for that. As we leave, all the fathers out there, I'd ask that you consider too um, how intentional you are. Consider the importance of the partnership in the relationship you have with your children's mom. Consider the fact that every moment that you have to spend with a child could have an indelible impact on your child, and make the most of that. So I thank everybody today for joining us. This has been a wonderful journey in fatherhood. And until next time, I thank everybody. Thank you, Frank.
Thank you.
Take care. Bless you. Bye bye.